So before I hand over to Martina, I would also like to thank Professor Eamon Keenan and Dr. Carmen Regan for being here today and giving up their time to present to us. Again, lots of questions are coming in about, the cannabis and smoking and pregnancy and smoking. So I'm really thrilled that you guys were able to come. So enjoy the day, guys, and over to Martina.
It's lovely to see so many of you here today, guys. Thanks a million for making the effort. I know, it's not easy to get up at 6 o'clock in the morning or whatever time you got up and travel, and especially from long distances, north and south. So thanks very much for making the effort. So I'm just going to give you a little sense of what's going on in the programme. Some of you might know bits and pieces of what's going on, and we can do questions or whatever afterwards if we have time. But just in terms of introductions, you know who we are. So I work as lead for the programme. Ed is over there, Ed Murphy. Ed does all the business stuff and budgeting and all of that kind of stuff, PQs. Katrina is our We Can Quit and Inequalities Coordinator. Aisling works in Quit Manager PM, and she's PMing that, and she's also Evidence and Information and does all of our data. Elaine, as you know, is our National Coordinator for Stop Smoking Services. We have a tobacco-free campus post vacant, which is unfortunate, since Pauline retired earlier this year. And hopefully we got in, she was still in post in December, so we have that post. Hopefully we will be able to replace her. Ellen McNamara, do you know Ellen? She's outside, so Ellen's super user lead on Quit Manager, and Danica, our admin support and as super user as well. Dr. Paul Kavanagh's on leave today, so he's not around. He's our clinical support for the Tobacco Free Ireland programme, and Doreena's around in the room somewhere, is she? Not yet. Okay, so Dorina Carr works on our Quit campaign. She's going to be presenting later on. We have a Tobacco Free Ireland programme steering group, and we report to Health and Wellbeing and Philip Crowley's office. So in terms of what we're doing, so in terms of Stop Smoking service, the normal kind of day-to-day stuff. So that we monitor the service, we coordinate and report back to the department on KPIs. And the department are very keenly watching. We're reporting more regularly than we would have in the past because they're watching the NRT space. So they want to see, even outside of the normal times, how many people are using NRT, what's the success of the NRT investment, particularly because we're putting bids in for more money. As you know, we initially got about 726,000 for nicotine replacement the first year we got it. Then we went in for a new bid. We got an extra 1.1 million. So we've got 1.8 million at the moment. And we put in another bid for another circa million. So I am quietly confident that we will get it. But we will wait and see. In 2 weeks' time, we'll kind of know whether or not we got that extra investment. But they are really, I suppose, pleased with the outcomes, and I have a few slides on how we're doing in terms of nicotine replacement and how that's, I suppose, supporting more quit attempts and more successful outcomes. So in terms of Quit Manager, I have a slide on Quit Manager. We also did a piece of work this year whereby we kind of closed the Quit Manager project on paper, okay? So we closed that on paper, and then we applied for new funds to finish off some of the pieces of work that we wanted to do on Quit Manager. And I have those listed later on, so I'll go through that. And so that went to OCIO for capital budget, and we heard there about a month ago that we got that money. So that's really positive. Elaine talked about NCSET training, so that's the training to become a Stop Smoking advisor. So we still have a couple of places on that. We do our webinars, as you know, for yourselves in terms of support. Elaine does a lot of the monitoring on our Quitline contract, and we're lucky to have some of our Quitline staff. I think I saw Louise around somewhere. There you are, very good. We're involved with our international networks, so we're on a couple of groups. So we're on a Quitline network, and we're on our GNTH network, and we actually have some colleagues from Switzerland. So Suzanne Kolik is here she's the chairperson of the Global Network of Tobacco-Free Healthcare Services, is here from Switzerland, and Laura is also here from Catalonia, Spain, also a member of the GNTH network. So we're delighted to have the guys here. We had our General Assembly on the GNTH network yesterday, and we had a site visit out in Portrane at the Central Mental or Forensic Unit. And thank you, Frank, for hosting us. Frank is here as well from that forensic unit. Obviously, We Can Quit is now a bit more embedded. Obviously, still, struggling in some areas to try and recruit, but it takes a bit of time to build up capacity and build up the skill and all of that. But We Can Quit, working away. Incentivise Quit, so the FIS, Financial Incentive Stop Smoking Service, that's what it stands for, but we're going to try and move away from the acronyms and try and get back to plain English. But we're really excited to be starting Incentivise Quit in 3 different sites. So this is where we are paying people essentially to quit, I suppose, in layman's terms. So it's a specific inequalities measure. It's not going to be one for everyone in the audience. We know this works from our Cochrane reviews. So what we're doing is to look at how it works, and we're testing implementation basically in 3 different pilot sites in Ireland. So we're testing that in Limerick and Kilrush, in Longford and in Cabra, Finglas. And thank you to the CHOs who have offered their support and are going to work with us to test it. So we're starting those workshops where we're going to co-design what the incentive will look like, how much we will give, at what stages of the journey we will give, how we will verify quits. All of that will be decided through those workshops over the next couple of weeks. And then Elaine mentioned about the tender process. So what we hope to achieve is that we will have one pharmacy provider that will have a good footfall, and we will be able to send our clients physically to pick up their prescriptions and or post but reduce the amount of posting we're doing to try and cut costs. So we want a network of pharmacies that have a good footfall in Ireland. In terms of Quit campaign, we are continuing with our kind of campaign, the month approach, where we're having kind of 3 really key months for Quit campaign. So January, March, and we're just coming up to October, where we'll have kind of Stoptober, Quit for October, Quit for 28 days, and we'll be out on TV, we'll be out on radio, we'll be out on social, and Doreena's going to talk a little bit more about that. In terms of this year, what we've done around, evaluating the campaign and all of that is we're working with digital and HSE comms to develop the Quit app. So there's going to be a new HSE application, and we're very lucky to be one of the first, I suppose, kind of programs and support services that's going to be available and supporting through the app. So there's a bit of building that needs to happen in the background to make the app work. So that's happening in the background, and we're scoping all of that, working with the teams. We also did an evaluation on the Quit pack, the physical pack that gets posted out to people, tested that with users just to see what part of it is useful, what part of it is not useful, and could we take things out. One of the things that they said they didn't like was the money box, the troker box type thing. So that's going to come out, but it's going to be available within the app. So you'll be able to calculate and save your money through that. So some of those kind of things really exciting. We've a new Quit booklet as well. So I was hoping we would have it here today and physically ready, but it's back with NALA, the National Adult Literacy Service, just to kind of get one final look. So we didn't get it printed in time, but we will share that with you online and on email very soon. We're going to have a video premiere, are we, Elaine, later on? Yes. Thank you to Lisa and Julianne for doing those NRT videos. So we have new video content that we filmed in August time around how to use nicotine replacement and what to expect when you come to a stop smoking service, so that we will be able to send that content through the app. We will be able to point people to it, and you can point people to these short little clips as well through Quit Manager. We will have the link that you can put in there and kind of send it to people, and they can just look at that on their phone, just in terms of how to use some of the products. So you'll be able to see that later on. Clinical guidelines work. So as you know, we're in year 3 of a 4-year clinical guideline implementation. One of the recommendations and one of the projects within that was to develop the online stop smoking medication training. So we've developed that, and that's launched. So I'd encourage you to, make sure you share that with your colleagues and the doctors and nurses that you're working with and you're engaging with in primary care and in acute services. We did a survey on clinical guideline implementation in maternity, and Aisling did a lot of work on that and the analysis. So we asked all 19 units, what were they doing around carbon monoxide monitoring? What were they doing around assessing smoking prevalence? What were they doing around treating? Were they prescribing? How many staff were trained in MEC, for example, or whatever? So those kind of questions within it. I don't think we've presented that to the group, have we, Aisling? So we might actually present that at a webinar to give you that feedback. So, you know, some positive implementation happening in some sites, but definitely room for improvement across maternity in terms of stop smoking care. And we plan to repeat that type of survey with acute services and with mental health services, just to kind of get an as-is picture, and we'll repeat it again then in a couple of years' time to see if things have improved. In terms of tobacco-free campus, as you know, we had a really successful year last year in terms of the bursary, and we were in this room around, summertime last year, where we had over 100 sites, 106 sites actually, were awarded a bursary for their work in terms of tobacco-free campus and advocating for the policy. And we allocated over €300,000 to sites. The thing about tobacco-free campus and that fund, unfortunately, was we were using underspend from other programs, sexual health programs, and different other programs that hadn't come to fruition. So tenders, for example, budget that had been given to the program to do a tender, and then it takes a year or two to get that tender in place. And then once the tender is in place, the budget is now gone for the company. So unfortunately, that was budget that we had. But it isn't kind of a secure year-on-year budget. So I have put in an estimates bid for tobacco-free campus to try and secure a budget. So I'll have to wait and see in the next couple of weeks if we get that. And because I'm sure a lot of you are disappointed that we're not running a kind of a national TFC kind of bursary scheme. The other thing was just the challenge in terms of resource and logistics when we don't have an actual person to kind of do that, and we're just flat out doing lots of other work. But that's not to say that tobacco-free campus work shouldn't be happening in your sites. So you still have a role around that, many of you. So it's really important that you continue to engage with your sites and continue to advocate for improvements in tobacco management within sites and settings. And hopefully there will be either local schemes or potentially a national scheme should we get budget. The policies are still not gone to the DOH, but that's impending. We have done all of the consultation on the TFC policy and the secondhand smoke policy revisions. So we're pretty happy that we're ready to go to the board and the Joint Council of Unions with that. And then we'll have to revise the toolkit after that. But there's no point in looking at the toolkit until the kind of policies are fully signed off. And we continue to engage with our colleagues in G&TH around the website development and various other pieces of work that we're doing. Katrina has been working and Ed on the SPHE junior cycle curriculum, and they're working on year 3, so for third years, on some smoking and vaping content. So you're aware that year 1 and year 2 are there and they're up online, but year 3 is almost complete. We also launched earlier in the year a new e-cigarette resource for prevention of e-cigarette use in youth, and this is for out of school settings. The other work that's just about to start is early years programme. So the early years programme are developing new online training for childcare workers, and we're putting some content in there around secondhand smoke and prevention of smoking. So we're just about to start that project as well. So that's really positive. So this, just in terms of Quit Manager, the things that have been funded and that we've got money from the OCIO on is enhanced health link integration. That's almost done. So this is whereby we're going to be sending a message back to GPs to tell them what happened with the referral that they sent to us, and then the discharge notification as well. Now, there are some issues with their systems in terms of accepting the message. So some systems might not be able to take it, but hopefully most of them will, and that's still ongoing. It's kind of a daily process at the moment. Aisling is has her hair torn out trying to work with the team to kind of figure that out. But we're nearly there, I think, in terms of enhanced health link. The quit.ie app work is being scoped, as you know, and we have funding for our side of that part of it. Our plan is to have integration between Quit Manager and the pharmacy provider that we procure, so that it will happen. We won't have the medications template. I'm sure you'd all be delighted if you don't have to fill out that medications template. So we'll be able to do it within Quit Manager eventually, but we'll get there. The IHI, so the Individual Health Identifier, this is where our system, when it's kind of sending data to another system or whatever, that there will be IHI coding happening in the background. So we'll be able to, particularly with the app, that when you come in through the app, we'll be able to identify that Mary O'Reilly is the same Mary O'Reilly with the same date of birth, and if we've seen her before, So all of that is quite technical work and quite expensive work actually, but you won't see the benefit of it in terms of Quit Manager, but it just has to be done in terms of kind of identifying the same patient through the IT systems and having them all link up. Obviously, we know that we have to kind of improve Quit Manager from a vaping point of view and be able to record all of the vaping nuances that might happen within a client's journey, whether they're coming in vaping, whether they're quitting using a vape. All of that needs to be able to be recorded properly within Quit Manager, so we need to do the redevelopments within Quit Manager to be able to record that properly. The regional health areas and the community health network areas, as you know, Quit Manager is based on CHOs. We've now all reorganised ourselves again as an organisation, so we now need to kind of edit the system and change the system so we're able to report in the new structure. So that is work that is kind of expensive to do, and we don't see too much benefit, but is necessary, unfortunately, and we kind of have to do it. The plan is that we will be able to take data extracts from Quit Manager and put those into Power BI and be able to kind of analyse the data a bit more within Quit Manager. There's talk of a data lake, particularly, because when people come in through the app, we'll be able to kind of see if it's the same person that re-engages again, on the phone, on the Quit line and stuff, and if they get referred straight into Quit Manager. So, that's kind of exciting stuff, that we will be able to kind of have more access to data and more access to, looking at the kind of profile of patient that comes through and if they're re-engaging and all of that. And then the other piece of work is the maternity integration, so integrating Quit Manager with the MNCMS system that's been rolled out across the 19 units very slowly, but getting there as well. In terms of Sláintecare, as you know, we have been working with ECC. We're now going to be sending the ECC data, so the Enhanced Community Care Clinic activity centrally to the ECC programme, and that's been reported. So Aisling sent from January to August there the other day and is going to be sending it on a monthly basis. So that takes a little bit of work off for yourselves. And we resolved all those issues around which clients can be included and which clients can't be included, and do they have to have chronic disease, or do they, already chronic disease or not. That was all kind of ironed out. In terms of the research pieces, as you know, the Incentivised Quit, that's the HRB funded study that we just talked about. The survey of maternity units that Aisling did, that's complete. We also have a paper in with the journal at the moment on nicotine replacement use and the outcomes of that. So that's within an academic journal for peer review at the moment. And we plan on doing the surveys around tobacco control and tobacco guideline implementation within acute and maternity or acute and mental health sites. We collate the data from the SAP system in terms of what are we spending on nicotine replacement versus what have we accrued, and just kind of looking at all of that because on their meds tracker. So Aisling does all of that analysis. Thank you, Aisling. And we try and estimate the spend and kind of keep a track on that. We know that we're overspent so far in a lot of the CHOs and potentially in the national office as well. We were committed on paper that some of that 1.5 billion extra money that came to the HSE was for us. But try as I might, I cannot get something in writing, a letter from the department to say that there's a part of that ring-fenced. I'm really hopeful that we will get some money in the new budget, but fingers crossed, fingers crossed. In terms of e-cigarettes, so we did a webinar back in May with the National Association of Principals and Deputy Principals to support secondary schools, and Noreen supported some of that work. And we have a podcast on smoking and e-cigarettes as well online. So just to remind you about those resources that are there, if people are asking you for support, whatever, those are online. They're in the Health and Wellbeing podcast list. And we've got 4 PQs this year, so our elected representatives are very interested in tobacco control. They ask us regularly, what are we doing? What are we spending? How many staff do we have? All of those kind of questions. Where we have the data ourselves, we don't go out and ask you for it. But just to let you know, and we can share the questions actually, Ed, we could maybe share those just so you can see that our elected representatives are asking questions. This is just images, so that's just the new medications online training and our new app. Just to remind you of these resources that we have, so the clinical guidelines, the frequently asked questions. You can see all these on healthpromotion.ie. We have the mouse mats, Ask Advise Act. I don't know if any of you have gotten physical copies of those mouse mats, yeah? They're down in healthpromotion.ie if you want to order them. And we have the quick guide or glance at stop smoking medications if you're not familiar with that as well. This is just our e-cig resources, just to remind you of the images of them, just that you can download those as well if you want. The one there down on the bottom here is the new resource that we have published around for out of school settings. Dates for your diary. Okay, so we're going to do a webinar for stakeholders. I think it's the 20th. Are we still kind of toying around with dates, Noreen, or are we good with the 20th? Where's Noreen? Yeah, I think we're good with that one. Yeah, perfect. So this is where we're going to do a webinar with external stakeholders. You're probably not the main audience, but you're welcome to come, just around what we're doing in tobacco control. So there will be kind of stop smoking services, the activity, the new medication, things that people mightn't be aware that's happening, and address some of these cigarette issues. We have a date for the World Conference on Tobacco Oral Health. It's going to be a 3-day event, so we're delighted to be hosting that in Dublin, the 24th to the 26th of June next year. So dates for your diaries. I don't know, how expensive it'll be to kind of go to that, but just make sure that you're thinking about that in your budgets for next year, that you have, if you want staff to attend, that you put aside some money and profile a budget to allow staff and facilitate staff to attend, particularly because it's here in Dublin. It's cheaper to go to the World Conference, obviously, in Dublin than it is to go somewhere internationally. If you have any papers that you want to be thinking about submitting for plenary, for the poster presentations or whatever, just be thinking about that. Those calls will be coming out soon. So this is just the data, just to see year on year how we're doing. And I just love that top graph, the one where we're showing how well we're doing in terms of stop smoking service. So this year we saw in January almost 2,500 people. You know what I mean? It's well, it might not be 2,500 people because it's A data technically, but roughly 2,500 people came in to service. So those figures are amazing in terms of we are seeing the growth, the investment that has been put in terms of stop smoking service, staff and now for medication is having an effect. And I remember being in a management team meeting a couple of years ago where I won't name names, but some managers were saying, well, look, you don't really have a waiting list in stop smoking service. There's enough services, you have enough people, just people don't want to stop smoking. There's enough, And I was making the argument, well, actually we don't have enough staff and, people aren't aware of that we have a service and there are barriers to accessing the service. If we build a service, people will come. And we got the staff and we got the money and you can see people are coming. So some of those managers had to eat their words after a couple of meetings when I reminded them of that. But it's just interesting. This is just our target and what we achieved year on year. So you can see, back in 2019, we would have had a target of 11,500 people. to see in the year, 11,500 data, and we saw 9,000 or just over 9,000. In 2020, it was around 10. It was based on staffing. We didn't have as many staff, obviously. And then the big jump was in 2022 when we got the staff on paper, but it took about 6 months, 9 months to actually get the staff trained and get the staff embedded and develop the staff. So we had the staff, we had to have the target attached to the staff, but we didn't achieve it that year because it took that time to embed the service. But last year and this year, last year was the first year we overachieved on our target at 102%. Amazing. And we're knocking it out of the park again this year at 67.6% to the end of August. So hopefully we will achieve our target as well this year, despite the gaps in service with people leaving and maternity leaves and all of that. You know, I know there are challenges in some areas, but we are still overall as a service doing really, really well. In terms of setting a quit date or using NRT in their quit date, so we can see a growth in 2021, 67% of people set a quit date and used NRT, and last year it was 78%. Or Q1 of last year, it was 78%. So a 10% jump. So that's amazing, over a 10% jump. So a lot done and more to do, as they say. So that's really it in terms of the programme. I can take a question or two because I think we have a bit of time, have we? 2 minutes. So if anyone has a burning question on anything particular, I'll take a question. Otherwise, you can catch me throughout the day. No? Okay, we're good. Thanks for that.